And more than 1 million New Zealanders live with asthma or a respiratory condition. It's the third leading cause of death in Aotearoa, and there's an asthma attack every couple of minutes. Māori and Pasifika communities are among the hardest hit, with children frequently hospitalised. But health charity Asthma New Zealand says there's plenty of help available, and some famous faces are speaking out about their experiences.
650. What about 649? I just know I've had asthma since I can remember.
I would be in bed at night and literally couldn't breathe.
Because I tried to silence my asthma, really. I was trying to be like, nah, I'm fine.
You don't have to do this alone.
Yeah, well, with us now is University of Auckland Associate Professor specialising in respiratory issues and Asthma New Zealand Clinical Lead, Amy Chan, and Jessica Smith, whose daughter Alani has asthma. Good morning to all of you. First of all, well done getting Alani in here. She's three, isn't she?
Yes, she's 3.
Yeah, she's doing really well this morning, Jessica. Again, thank you. Amy, can we talk about this being a hidden kind of issue for people? Because we know that there are, over 1 million people that have it here in Aotearoa. So talk to me about it being a hidden condition.
Well, yeah, it affects over 1 in 8 children and 1 in 8 adults, but it's often not talked about. We know a lot of other conditions often take the spotlight, such as, cancer or heart disease. But so many people who have asthma, I think that just becomes a common condition that people think, oh, everyone has a bit of a shortness of breath. When they're running on athletics day, kids just get used to this degree of shortness of breath. But really, it affects, like you said, over 600,000 New Zealanders, and definitely something that we need to put much more of a spotlight on.
Nurses go into homes, they go into schools, they're out and about in the community. What do they say about asthma and what they're seeing within the community? Yeah,
well, as you mentioned, asthma is so uncontrolled, and we've seen an increase in asthma attacks in the last 10 years. So even though the numbers and percentage of our population of asthma have stayed relatively the same, the number of asthma attacks have been increasing, and that is really concerning. And I think one of the most important things that nurses are seeing is that inhalers aren't being used properly. We've seen significant changes in asthma guidelines, which has been really exciting for New Zealand. But in terms of making sure that people actually have the right treatment and to get the right inhalers for the right person, that's still a big step away. And I think our nurses and our health professionals have a big role to play in terms of going to people's houses and helping people manage their asthma through better inhaled treatment.
Yeah, I want to talk about that shortly. But Jessica, Alani has asthma.
Yeah.
So how is that for you as a mum?
It's been a long journey, quite long. So she first started experiencing asthma symptoms when she was about 1. And so it was quite young and scary to be seeing your child not be able to breathe properly. We've gone through quite a few preventer inhalers before finding the one that fit her right. But yeah, really, really scary watching your child not be able to breathe at night, or having to stop them from what they're doing with their friends and they're not understanding it because you're not breathing well. Yeah,
and I wonder what that's also like too, because as a mum you're going, oh, maybe you can't go and do that because you know that there's potential for her to be short of breath, etc.
Yeah.
So that must be tough for you too, to have to make those decisions that you know that she's going to be doesn't quite understand.
Yeah, exactly, and that's just right. She doesn't understand it, and she doesn't understand why she's unable to breathe when she's running around, and she can't make that link between that. Do you need your inhaler now, do you? I think you're all good, honey.
Yeah, I mean, it must be, as a mum of a child who does have, or children that do have asthma, I know how scary that can be. And you watch them, right? You watch them, making sure that they're breathing in, breathing out. Yeah. Amy, you were talking about preventers, inhalers, and that sometimes we don't quite get it right. And that's me. Sometimes I'm a bit confused about which ones I'm supposed to be using. I know we've got a couple here. I just wonder whether you can give us any information.
Yeah, the thing with asthma is often that people think it just comes and goes all the time. So it's easy to think you only need treatment when you have these symptoms. But the thing with asthma is that it's always there. Yep. And actually we really need to treat that inflammation. And to treat that, we really need something called anti-inflammatories, which is in your preventer medication. So here often it's either like your red inhaler, your brown inhaler, or purple inhalers. Those are the ones that people need to be using to keep on top of their asthma asthma. But it's so easy just to try and get relief, which is through your blue inhaler or your grey inhalers. And just because people just think, oh, it comes and goes, I'll just take a puff and it'll get better. But we're not really treating the underlying cause, which is why it's so important to think about which treatment is right for you and making sure you use inhaled treatments. And that's where, you know, charities like Asthma New Zealand and our nurses, our GPs, our pharmacists really can make a difference in helping the education.
Jessica, you were in the little clip that we had, which had Adi Savia in it, Mia Mutu in it as well. How important do you think that is for that kind of information to be out there, and for these sports stars who've made it to the very highest level to be saying, hey, look, actually, I suffer from it, and this is actually some information that we're trying to share with people?
Yeah, it's so important, so important, especially because, like Amy was saying, getting that information out about being able to use preventer inhalers, because it's quite often that I've heard from other parents as well that you're just given the relief inhaler initially as, you know, just to mask the symptoms really initially. Those are lights. But it's so important. It's really, really awesome to see, well-known names talking about how they struggle with asthma.
I love it. I think Alani's had enough now. She's hungry now. We've only got about a minute left, Alani. So, Amy, there is help available, right? If you're unsure, you think that your child might have asthma, not 100% sure, you've got all this stuff, what do I do with it?
Definitely seek help. I mean, the best thing you can do is talk to someone about your asthma. So there's help available, like Asthma New Zealand offer completely free education. So you can reach out, just contact them. They'll come and visit you. Any of your pharmacies, your GPs are really good sources of advice. So really just talk to someone. If you're struggling to breathe, that's not okay. Really seek help is something that we can do to make a difference.
Amy Chan and Jessica and Alani Smith, thank you all for being with us this morning. And Jessica, well done, Mum.
Thank you for having us.
Yeah, well done, honey. I feel you, girl. It is about that time, isn't it? I'm a bit hungry too.
Mum, I take this off.
Yeah, we'll give you a little studio tour in just a second. You can see all the other big
She's
lights.
hungry,
too.
she's over. Yeah.
She doesn't want my personalised tour? Okay. Right then, Hadi Akane, we'll be right back after the break.
Somebody else